Hi, welcome to Adventist Healthcare and You, Adventist Healthcare's podcast all about health. This is actually our first episode, episode 1. I'm joined by Nimit Kapoor.
Hi, everyone.
Hi, Nimit. And this is, I'm Shanna. We introduced ourselves in a little intro episode. So check that out if you'd like to learn more about us. Today, we're joined with Dr. Avni Jain.
Hi, everyone.
She's a family medicine physician with Adventist Healthcare. She's been at Adventist Healthcare for 10 years, and she's actually my own personal physician. So I asked her to come on the first episode to talk all about sort of a healthcare reset. You know, COVID is taking a different turn, or it's just in a different phase. And we're hearing all about sort of what to expect for the winter and stories about people delaying their care. And I really wanted to have Dr. Jain on to talk about what she's hearing as a primary care physician in the office from her patients. And Nimit, I know you've got some questions today too. So
Yeah, I think it's an exciting opportunity to, have a health reset and talk about, what we need to do going forward. So I think this is a great start to our podcast.
Yeah, me too. And it's also kind of coming at the end of the year, near the end of the year. We're recording this in November. So as people start to think about the new year, it's a good time to kind of start with this topic.
Sure. I think that's a great idea, Shanna and Nimit. And yes, people had taken a break from sort of taking care of themselves, but now people are coming back and they have been concerned about their health. We've had some findings not so good just because they haven't followed up in the year. But I would say most people are getting back to taking care of themselves, which is great to see. And I would recommend that if we follow the full COVID precautions, they take care. I think the offices are a very safe place to come and seek healthcare.
Dr. Jain, you said that, people are coming back to get healthcare. Are they asking like different questions now? What are some of the things that they're looking for now versus what they asked for about a year ago or more than a year ago?
Yeah, so COVID took everybody by surprise. Nobody was expecting this. And so as now, whatever everybody went through, people definitely have become more concerned about their health. They're asking about vaccinations, about boosters, how they could keep themselves and their families safe, and what they could do as a household to protect themselves from getting sick.
I think that's great. I think those are the questions we hope people are asking for all the time. But so I think that's a good turn that we're taking towards being healthier and asking the right questions.
I agree completely.
Yeah. So how has the past 18 months been for you? Like as a primary care physician, everybody's been affected by this in a different way, but you in particular as a healthcare worker, physician in the office all the time, how has it been?
I agree. I would say it's been both good and bad. So as a provider, it's been stressful because I've seen a lot of my patients that have gone through COVID, some not with very good outcomes, some that just went through and got better and are back to being normal again. But it's been a hard transition, I would say, because, initially when we were doing televisits, it's great that we adapted to televisits, but it was hard for a lot of people to, actually not be in the office and for me not to actually see them, touch them, examine them to see what was going on. But I think we all adapted beautifully. In my office, after I went back in May to seeing in person, I felt like as if COVID never happened because people were still getting sick, you still need healthcare, and they were coming in for their acute visits. I think this was as a primary care provider, but as a mom, I feel like, at home, thank goodness we all stayed healthy and I've had the good and the bad share. The good was that we all got time to connect as a family. And when kids were home, my husband was home, but I had that constant fear that I don't want to bring COVID back home. How can I keep my family safe? So trying to take all the extra precautions at work so that I could keep my family healthy, I thought was a little challenging.
Yeah, I think we all probably experienced that. That sounds very similar to the thoughts that I had coming home to my then 5-year-old.
Definitely.
And my husband, because we were coming in and out of the office as well. So, and Nimit, you were working in the ICU with COVID patients. So I'm sure, those thoughts were
Yeah, it was,
right in the
similar
forefront
to
of your
Dr.
mind.
Jain, like it was a daily thought, and every day you took those precautions, you took those extra steps and to make sure you were safe and keeping your loved ones safe.
Right.
Yeah.
So, I think we all went through it. And I'm sure our listeners, they go to the grocery stores, touching random things over there. It could be people are worried about that as well. So I think the key is to take extra precautions, even, despite of COVID, even the flu season.
Right.
I know people are taking extra precautions now. So, I'm grateful that we are at least addressing those concerns.
I know for me personally, throughout COVID, I was thinking of my health. Like that was sort of at the forefront. How do I stay safe? How do I keep my family safe? But also thinking through what can I do to keep my mental health stable? I'm just thinking about my health differently. Like I don't want to get sick, but I want to stay healthy. So are people thinking about their health differently now that their health has been at the forefront? People heard if you're high risk, if you have diabetes, if you have if you have heart disease, if you're high risk for any of these things, you're at high risk for severe COVID. So I definitely was thinking about my health a little differently too, because I didn't want severe COVID. So are they coming now thinking differently?
I think so. They are. And Shanna, you brought up a good point about mental health. And I just want to talk a little more about it because that has been such an important aspect during these past 18 months. And I feel like kids and adults alike have been affected by it. I cannot tell you on a daily basis how many patients I see that have gone through either a loss of a loved one or some financial crisis or their home being taken away or, whatever. But they've gone through that and it's heart-wrenching to see them going through this. And it's great that they are coming up and talking about these problems because this is such an important point. And I want to stress upon this to everyone, that come and talk to your doctor about your mental health. Your physical health is important, but your mental health is even more important.
Yeah, thank you. That's good advice. So as we think about our health a little differently, is there a misconception people have about their health? Do they think about something in particular? Is there a question you always get asked or a myth that seems to come up all the time?
Sure. Yeah. The one thing that I want to tell everyone is that you need to do very little in order to feel healthy. Little steps make a big difference. When people come to me and all of a sudden now I'm seeing a lot more physical. So we're talking about your mental health, your physical health, your weight, your vitals. And when we talk about weight, and obviously a lot of people have put on what they call COVID pounds, and they're like, oh, we need to lose 50 pounds in order to feel better. And, 50 pounds seems like a big number. So I just tell them little baby steps. You won't feel overwhelmed and you'll see a big difference. And I think that just does not go with weight. It goes with everything. Little baby steps, big difference. You always don't have to do big to see a big change.
So what are some small things people can do, to start working towards better health?
I feel like in these COVID times, we've talked a lot about exercise, about meditation, about how exercise improves mental health, about eating healthy because everybody was home cooking too much. So, obviously being the fitness enthusiast that I am, I want to stress upon the fact that it's important to eat healthy, especially now with the holiday season coming up. Make sure you're eating your fruits and vegetables. Make your plate as colorful as you can. Get your 30 to 40 minutes of exercise. A lot of times we forget about sleep. Good sleep hygiene is very important for overall well-being. And those are the little changes that you can make. And obviously you'd see a big difference.
Yeah, I was just telling someone that over the weekend. I have always been someone that I need my sleep. I was never someone that could do 4 hours or whatever. Like for my mental health and my physical health, I just feel better when I get 7 hours of sleep.
Of course, definitely.
And I was the opposite spectrum for
Were you?
that for the longest time. And then, over the last few years, I've been much better about that because there's more and more research that has shown that, healthy sleep is the key to your well-being. So I try most days and succeed most days.
Sometimes I prioritize binge watching TV or reading or something in the evening, but I really try to push myself
I think
to get
that's
to sleep.
some of mental health as well, right?
Yeah. When you mentioned being a mom and, Nimit, you're newly married and everything like that, but an hour of self-care at the end of the day after when the house is quiet, that is something I need.
I think that's therapeutic.
Yes, agreed. I want to wrap this up because we promised our listeners that we would always try to keep this short and digestible for them to listen to and easy to listen to. So I just want to ask maybe one or two other things. What surprised you the most coming out of COVID? We're not out of COVID by any means, but, what surprised you coming out of all of this?
I'm still surprised by the vaccine hesitancy that a lot of people have right now. And I want to use this platform to tell people that, I'm a big supporter of vaccines. My kids are 13 and 16, and the day Pfizer got approved for adolescent vaccinations, they were in line to get the vaccines. And yes, I was a little hesitant about it, but I just want to use this platform to say that millions of doses have been given, and the side effects have been there, but they're rare and few. So the only way we can come out of this pandemic is by vaccination. So do your bit, do your part, and get vaccinated.
Thank you.
Yeah, I think that's a great point. I think people are also more willing to take the flu vaccines too, knowing the benefits of the COVID vaccine. So I think, the vaccination should definitely be the top priority for majority of the people.
I agree.
Anything else you want to ask Dr. Jane Nibbett? Did we cover everything?
I think we covered everything.
All right.
Great.
This is great.
Well, thank you for sharing your experience with us and your little tips. Is there any last thing that you want people to know about their health before we wrap up?
Again, I'll just say this. Mental health is very important. Your sleep is very important, and vaccines are very important. So if you haven't been to the doctor in the last 18 months, now is really the time to reach out to your doctor and get your care back to where it was.
Thank you, Dr. Jane. I'll be making my visit soon, I guess, following your advice.
So would I, yes.
All right. Well, thank you, Dr. Jane, for coming in today.
me.
Thank you,
you so
Nibbett,
much.
for being here
absolutely.
as well. And to our listeners, don't forget to hit subscribe so you can get updates on our new episodes. So thank you all for listening, and take care of yourself.